Every medical practice owner in North Carolina knows an uncomfortable reality. Managing billing here requires specific administrative discipline that does not apply in other states. The local regulatory environment creates immediate friction. A failure to distinguish between the routing logic of a tailored plan and a standard NC Medicaid direct claim leads to an automatic rejection. These rejections stall cash flow for weeks. Resolving them requires manual intervention, drawing focus away from patient care to navigate payer-specific hurdles. This is not a reflection of staff competence. It is the result of a system that penalizes practices for treating North Carolina's localized billing requirements as a standard clerical task. Mismanaging this complexity results in substantial revenue leakage, turning a practice's most predictable asset into a financial liability. The NCTracks system dictates the scale of the challenge. It manages claims for approximately 105,000 providers, serving over 3 million citizens across the state. The rules within this system change rapidly. In 2025, the state's health plan billing guide moved through 3 complete versions in just 6 months, requiring constant adjustments to submission protocols. Geography also dictates payer structure. In early 2024, the state consolidated Sandhill Center, East Point, and Trillium Health Resources, changing how behavioral health providers route claims. Teams that missed this structural change missed narrow filing windows, leading to uncollectible claims. In late 2025, a temporary fee reduction and its subsequent reversal forced practices to track retroactive reprocessing for thousands of claims. The burden of ensuring these corrections were paid fell entirely on the practice's administrative staff. State-specific medical billing is a high-maintenance process. It requires daily monitoring of payer bulletins and policy updates to ensure the practice remains compliant with the latest version of the guide. This line graph illustrates a deteriorating national trend. Data shows initial claim denial rates rose to nearly 12% in 2024. This trend impacts the bottom line, with practices commonly losing 4.8% of net revenue to these denials. The cost of correcting these errors is significant. The average cost to rework a single denied claim ranges from $25 to $118, depending on the complexity of the rejection. For a mid-size practice dealing with 200 denials per month, the labor cost alone reaches $10,000 monthly, before accounting for any claims that are written off entirely. Inefficiencies create a dual penalty: the cost of submitting the initial claim and the high labor tax required to fix it after it is rejected. Many practice owners attempt to solve this by hiring a dedicated in-house expert to oversee the billing cycle. This loop shows the reality of internal staffing. MGMA data indicates business operations support staff have an annual turnover rate of 33.3%. When an experienced biller leaves, they take years of localized institutional knowledge with them, including a nuanced understanding of NCTracks navigation. Replacing that knowledge is a slow process, typically requiring 30 to 90 days of onboarding before they operate at full capacity, leaving a gap in revenue cycle performance. Finding qualified candidates is also getting harder. Over half of medical group leaders cite candidate sourcing as their top challenge, and a majority report the situation is more difficult now than in previous years. The internal staffing model is often unsustainable because it relies on retaining specialized knowledge in a highly transient labor market. The direct cost of an internal biller is higher than most realize. The Bureau of Labor Statistics reports a median salary of approximately $50,250 for medical record specialists. This stacked bar chart illustrates the fully loaded cost. Beyond the base salary, a practice factors in payroll taxes, health insurance, paid time off, and recruiting costs. In North Carolina, the total annual cost for one in-house billing position ranges from $55,000 to $75,000. Small and mid-sized practices are particularly vulnerable. Relying on 1 or 2 individuals creates a bottleneck. A single absence or resignation stops the flow of incoming revenue. Practices end up paying premium rates for an administrative system that is often just one resignation away from total failure. High-growth medical groups in North Carolina are taking a different approach. They are removing the billing function from their internal HR responsibilities entirely. Staffingly provides a dedicated external team for each practice, moving away from the shared resource model common in the industry. This team is composed of AAPC and AIMA-credentialed specialists, providing a level of expertise that most practices struggle to find on the open market. The integration is designed to be seamless. Staffingly's team works directly inside the practice's existing EMR, following the provider's specific protocols and payers. This transition turns a variable and often fragile internal cost center into a secure, consistent engine for revenue collection. This sequence is designed to reduce error rates below 1%. Stage 1 is a 14-day onboarding process where we map the practice's workflow, payer mix, and EMR configuration. In Stage 2, we deploy AI-assisted smart routing. This system automatically directs claims and verifies that authorizations are in place before submission. Stage 3 brings in our credentialed specialists to apply the nuanced logic required for North Carolina's MCOs and tailored plans. Stage 4 uses predictive claim scrubbing to audit data in real time, identifying and fixing errors before the claim ever leaves the queue. Finally, Stage 5 is a closed-loop quality assurance process, featuring daily random audits and weekly performance reporting on accuracy and throughput. By combining AI-driven automation with credentialed human oversight, practices can finally overcome the specific administrative challenges of the North Carolina market. The results of this model are supported by industry data. A 2024 Deloitte report shows that automated claim scrubbing and predictive validation can prevent up to 85% of avoidable denials. In North Carolina, smart routing is particularly effective at preventing common procedural errors, such as missing prior approvals or incorrect managed care routing. While the AI handles the high-volume data validation, the human specialists are free to resolve complex payer issues and manage proactive appeals. This model allows technology to provide scale, while human expertise ensures compliance with the state's rigorous billing standards. Maintaining a single in-house billing position costs a practice between $55,000 and $75,000 per year, plus turnover risks. In contrast, a dedicated Staffingly seat costs $399 per week, or roughly $20,748 annually, a significant reduction in fixed overhead. This approach provides enterprise-grade compliance. Staffingly is certified across SOC 2, ISO 27001, and HITRUST standards, maintaining an error rate below 1%. Outsourcing to a dedicated team eliminates the staffing burden, bridges the knowledge gap, and provides a clear path to reducing operational costs. Regain control of your revenue cycle. Start your 14-day pilot and experience a more predictable way to manage your practice. To get started, visit us at staffingly.com/demo. Call 800-489-5877 to begin your 30-day free trial.